No, I washed mine.
Okay, well, thank you so much for joining today for this lovely highlight of what it is that you do and who you are. And first of all, I wanted to give you the floor, let you introduce yourself and what it is that you do, and then we're going to kind of break it down so other people can understand. Because what I love about you so much is your brain. I know that sounds silly, but I really I find it fascinating. Like smart people, like really intelligent people. It's something that just draws me to them because I want to pick their brain all day about what it is that they do and what have you. So before I go on a rant about all of that, go ahead and I'm going to give you the floor and you introduce yourself and what it is exactly that you do, and then I'll start with some of the questions that I have preset.
Sure. So, I'm going to tell you my whole name. My name is Anju Iona Usman Singh, and I am a medical doctor, fully trained in the US. I went to Indiana University, really traditional med school. I did my residency in downtown Chicago at a hospital called Cook County Hospital. And I really wanted to get exposed to the sickest of patients, and I did do that. But then I was pregnant twice during my residency, and my kids started having issues, medical issues. And I went down the road of working with children, trying to figure out my own kids' medical needs. And in the process, I became kind of popular in the world of autism.
Okay.
And I started attracting patients with autism. And I remember meeting the one of my first, I would say my moms, like I call my patients my kids, but my moms. And she came to me with all these articles, and I was like, how come I don't know this stuff? And you mentioned the brain, and then I just went into like full force. I was like, okay, parents can't know more than I know about this disease. That's just not going to happen. And so I started studying and researching and self-teaching, and I started working with these kids using what you would call integrative medicine or holistic medicine to treat them.
Okay, which is great because that's pretty much where I'd like to start um, is that what drew you to the holistic medicine side of what it is that you do, and how does it differ from traditional medicine approaches in the way that you work with your clients?
That's a great question because when we think of medicine, we don't really break it down into traditional or holistic. When we go see a doctor, we're like, we don't feel well, let's get better and let's take medication.
Right.
And a lot of people don't even realize there's a whole world out there of thinking about health and thinking about how we feel in a different way. So when I was exposed to these children, they're little kids, and the only two FDA approved medications for them are antipsychotic drugs. And if you hear the word antipsychotic, you think, oh, you're psycho. You're going to take an antipsychotic drug. But they're not. And so the further we researched, and I was involved in a think tank in the early 2000s, and it just kind of evolved in working with this particular population and using non-traditional approaches because the only approach they really have for this population is psych meds and therapy. And when you look deeper, the underlying piece with integrative medicine is you're trying to look for the underlying cause or the underlying problem and treat the root
Right.
instead of treating the symptom.
And that's pretty much where traditional medicine is they treat the symptoms and they don't generally dig to the root of the situation.
They don't even ask the question.
No.
They
You're
never
right.
even ask the question.
I know.
Oh, why are you in my office 10 times for an ear infection? I'll
Yeah.
just give you another antibiotic.
Yeah, and it's so
Or
because you
why are you feeling anxious or depressed? Well, let's give you an antidepressant.
I've been in medical facilities myself for whatever reasons, and I could hear the doctor prescribing the same medication for each one. You know how, like in some settings, there's like a fast track kind of setting, and you can the walls are paper thin. You can hear everything. So I don't know how they get away with that because HIPAA is totally violated, but. I told the ladies, I'm like, listen, if you ever wanted to do fraud, I mean, not that I'm saying this, but this is why I hand you my information and I will not speak it out loud because you can hear everything, their address, their insurance. It's insane. But anyways, they prescribe the same medication over and over and over for a different symptom, but the same medication. So
Yeah. After I finished my residency, I was really excited to start practicing medicine, and I found myself prescribing antibiotics, antidepressants, blood pressure medicines, medicines for diabetes. And I thought, oh wow, I just started, and is this going to be how it is? Am I going to get my patients better? Are they
or
going to actually heal? And that's my practice is called True Health Medical Center because I keep asking myself the question, what does that actually mean? What does it mean to be healthy? And what does the word heal really mean?
yeah.
And when you're dealing with chronic issues, I understand they're chronic because we have them for a really long time and they're hard to clear. But there's a lot of roots to, there's a lot of roots to why we're having chronic issues.
Well, you're right about that. And I think a lot of it, personally, my opinion is environmental as well as, what we consume. But so let me just ask you this. Can you share a challenge you face along with the way you overcome it and or overcame it in your practice as far as dealing with the integrative um, process that you give for patients? Like, give me examples of what it is for therapy besides just prescribing a medication. Some of the therapies that you would prescribe for your patients to do, and some of the challenges that those actual patients face in obtaining those therapies
Yeah.
because of the
No, it's really difficult because when you're talking about mainstream and you're talking about how we're thought to think about health, we go down a certain road and then they say, "Oh, well, the studies show this." So then you're like, "Okay, let's do this." However, there's really no what we would say standard of care for working with actually chronic illnesses or even kids with chronic illnesses. And so let's just use the example of autism. There is no standard of care for treating that. So, say I find in my patient that there's a high level of lead in my patient.
okay.
And when I was at Cook County, the normal level of lead was 60. Then a few years later, it was 40 in the blood, then 20, then 10, then 5. Now, if you go and look at reference ranges, it's 3.5. So I had a patient with a lead level of, say, 50. It was really high. And I called their doctor and I said, this child has lead toxicity. And they said, well, they don't have lead toxicity because the lead level is 40, not 60 at the time.
Wow.
And so the 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 wall I hit is this wall of being black and white and people not thinking in the gray. Because for me, I get, I wouldn't say ostracized, but maybe I get put down because I would work to treat a patient with any level of lead in their bloodstream because any level of lead can decrease IQ, it can affect cognition, it can affect processing. So people could say that's not standard of care, but to me, that's actually care because that's treating an issue that is affecting a patient, but it doesn't fit into a certain box or model.
Yeah, clinical criteria of what the societal medicinal people consider norm, you know.
Yeah,
But
yeah,
it,
yeah. So when I those the roadblocks I would hit is kind of with the mainstream on ideas. Like, for instance, I'll give you like three ideas or four. One big idea is there's a connection between what happens in the gut and what happens in the brain. So your gut health affects your brain. More neurotransmitters are made in your gut than in your brain. So if you have any type of mental symptoms, they might be gut related. And so, what doctor does that? What doctor treats that? And then another big concept is toxicity, where we live in a toxic world. We're exposed to things like our food is full of chemicals and plastics and just not alive. And we're exposed to heavy metals and lead in our water supply. And then we're maybe exposed to mold toxicity in certain homes. And again, how do you deal with that? How do you get rid of that? And there are studies in terms of biological studies, but there's no good long-term clinical studies to show these things help. But it's the concept of the precautionary principle. These things are toxic. We don't want them in our body. Let's get rid of them.
right.
That to me is common sense. So yeah, the gut brain toxicity. And then when you're chronically ill, your body gets depleted. And there's certain areas in your body that get depleted, like your adrenal glands get really weak and they don't manage stress very well. And our mitochondria that makes energy gets fatigued and can't make energy. And so it becomes a perpetual cycle of being not feeling well. And so the roadblocks are getting doctors trained so they can understand when somebody's ill, chronically ill, these are the places to start.
You know, I find that I totally agree with that 100% because I find it ironic that doctors don't prescribe fasting more often. You know,
Yeah.
I think that really, because really we're set up to fail from the get go with from our soil to the environmental, everything that you've named, water sources, then goes into our food, then we consume it, which goes to our gut, which then triggers it's a trigger effect, you know, a domino effect, whatever you want to call it. But I do feel that fasting is not the answer to everything, but it almost can be, excuse me, it can almost be like that bulldozer that just knocks a lot of stuff out of the way so you can get to the foundation or the root of everything really quickly. If you can do it in a safe manner, you know, because everybody has different things going on and what have you. But what are your feelings about fasting?
Yeah, I was just gonna say that they've actually studied fasting and even what they call intermittent fasting to help with autoimmune conditions. And it helps with what you said. The fancy term for what you said is called apoptosis. Apoptosis is cell death.
Okay.
And as naturally our cells die, but when we're not feeling well, our bodies don't necessarily have the energy to clean them up. So they kind of build up like garbage in our body. And so the fasting is just kind of like you said, like it cleans up. It's like, okay, let me just go in and like shovel this stuff out and clean it all out. And they find that for men, 72 hours is kind of a reset for
Okay.
water fasting. And then for women, 48 hours. Because I work with children, I don't usually prescribe fasting just because they're children and not a lot of my patients are non-speaking and I don't know if they would understand the concept. So we try to do some of the intermittent type fasting sometimes.
What about now? That brings me to okay, so it's a lot of your clients are children, and and I agree you can't do the fasting the same as you would adults. But what about like intermittent fasting with sugars or non-sugars?
Yeah. So sugar's a big thing. So when I see patients, a lot of people with chronic illness, another big thing they have in common is inflammation.
Yes.
So inflammation triggers neuronal excitation.
That's a
So,
big word.
and neuronal excitation is excitation in your brain, and that manifests as anxiety, OCD, hyperactivity, ADD symptoms, and not sleeping,
Wow.
being agitated. And that's all from inflammation. I can go into the chemistry of that because I understand that a lot,
Yeah.
but the simplistic view of it is inflammation. I'll say inflammation triggers excitation.
Okay.
And excitation is manifest in different people differently. But the three most inflammatory foods are number one is sugar.
Okay.
Number two would be gluten. And number three would be dairy.
Okay.
So my population, 70 or more percent patients do report that they improve with a sugar-free and not artificial sugar, just, sugar-free, gluten-free, dairy-free diet.
Okay. I can see that. I've kind of done some of my own homework, like own little research on myself and what affects me. So I can't speak, for the world and how it affects globally, but I do know that um, I did a 5 day fasting, and I'm telling you, I have joint issues. So immediately I felt like there was nothing wrong with my joints. The inflammation, everything was just like completely wiped away. And it wasn't long term, because then, of course, I gobbled up some wrong goodies and I immediately, and I was like, wait a minute. Now
It's
I can,
almost like you get more sensitive after you fast because your body was like, whoa, that was nice. And then you take it again, you're like, oh, wow, that hit me. But yeah, with the kids, we say, try to avoid sugar. You can do some natural sugar like in fruit. But, sugar isn't just sugar, it's all those carbs like chips and popcorn and, all the snacky stuff.
yeah, the
And
fillers.
and then anything that's what I call an excitotoxin. An excitotoxin stimulates a neurotransmitter in the brain called glutamate. Glutamate triggers anxiety and OCD, and the big excitotoxins are MSG, monosodium glutamate,
Okay.
NutraSweet, red and yellow food dyes, nitrites, sulfites, high fructose corn syrup, and caffeine.
Wow.
Really the junk. Really the junk.
I'm a coffee connoisseur, so I'm just in the in the wrong there.
Oh yeah, caffeine has some benefits, but you don't want to overdo it.
So let me ask you this. What are you most proud of in your work?
What am I most proud of? I think I'm most proud of being there to support my families and walking with them on their journey because it's really tough for them. And I don't have all the answers, but we try to figure things out. And a lot of the patients who do this approach, it's called a biomedical approach or a functional approach. And I'm involved in an organization called FMAPS, Medical Academy for Pediatrics and Special Needs. And I'm proud of the education that I do for families and the support that I give families and the help that I think I've provided over the 30 years I've been doing this, the longevity of it all.
Yeah, that's definitely something that you really have to be heartfelt to be into and to dig deep in, because most of the parents that have children with autism are really they're really on the stretch of finding somebody that can, first of all, understand them and really listen and hear them. And secondly, they're in hope of, can this person help me? Can this person give me like sometimes they're wanting a magical cure or magical, answer and, a resolve that can happen, lickety split. And I know that they know that in their heart of hearts that that's not going to be, but still there's a hope, there's a wish, there's a something inside them that they all want, and that's hard. And I see a lot of people in that category that have had other not practitioners, of just holistic practitioners as far as medical doctors, but all the way around take advantage of them. So it's very important as to how to guide them into who to go see and what can be helpful for them, because a lot of these practices they have to pay out of pocket because there are no health insurances that cover these what and I don't like to even term it non-normal because it should be normal. These are
Exactly. I mean, the group that I'm involved in, we want this to be the standard of care. We want to train doctors, we want to train residents, so that they can, this is the first line. This is the first line. Cleaning up your environment, cleaning up your diet, um, taking things that your body might need, detoxing, working on areas of your body that are weak. So I tell my families, I'm here to try to help guide you and come up with solutions and ideas. I don't have all the answers. Nobody does.
right.
But I think the whole piece of where I'm proud of is that I do listen and I tend to tell parents to use their intuition a lot. I
Yeah,
feel like the families who actually use their intuition and come from a place of love and not fear, they're able to kind of open doors and open strategies that, um, they'll hear something or get those signs and then they'll tell me about it. And I say, tell me about it because I want to hear what you're thinking because that's important. And I think it helps me.
yeah, that's true. Okay, so can you share a success story where holistic practice has made a big difference in your client's life?
I can't give any specific names of people, but I have a lot of patients. I like May. May, I get these little graduation cards from
Okay.
families, and I get cards from high school graduations. I get cards from college graduations, master's degrees, PhDs,
Wow.
um, pictures of my new job. I'm on stage somewhere. I started this new business.
Wow.
And of course, my heart just goes out and I get so happy about those successes. I People ask me, what are the main things that help people, and everybody's so different that there isn't like one thing. Working on the gut, working on detox, hyperbaric oxygen for some patients has been really good. But it's a combination of things, and I think the people who get there are the ones who just keep going and stick with it and figure out what works, what doesn't work. If it didn't work, okay, that we put that on the back burner and keep moving forward. But we
Right.
do have those cases, and I had you actually do a pot or a class for me for some of my non-speaking patients because they're the ones that I'm still like, okay, how do I help them? They're non-speaking, they're extremely brilliant, they're extremely intelligent, they pick up on all kinds of things, but yet the world doesn't know about them.
And it's
And
so hard,
and they're
but
called spellers. And so I still like, I have a lot of them in my practice. So, my heart still hurts for them and their families because the world is difficult for them.
yeah, and not sensitive at all. Really the general public is not sensitive to any of that. It's almost like the further we go along, the less empathetic you see humanity is towards each other in a mass, maybe it's all the sugar.
It is definitely black and white more so, I'm this or I'm that, I'm here, I'm there. It's like there's
Yeah,
nothing in between.
yeah,
And I think the lack of tolerance, we I see that even in medicine, we see lack of tolerance to things. Like I have a daughter with multiple chemical sensitivities. She's intolerant to parts per trillion of a chemical. So she couldn't go to school. She couldn't go to, she can't go to a mall. She can't go to people's houses because people use things and there's chemicals everywhere. And she reacts really severely to that. And so she's, in a way, intolerant to chemicals. But I do see emotionally people are intolerant to one another and intolerant to ideas. And it's sad.
yeah, I agree. I agree. I always like to, even if I don't agree with someone, I like to hear their point of view. I like to see where they're coming from and maybe even try to look at things from their side. I feel that as I grow spiritually, I do that more. I don't just look at it from my way. Initially, I might, and then I say, wait a minute. I pull back and I look at it from their way and then how they've described it. And then I look at it entirely from a spiritual perspective. So it's almost like I'm getting, three and four different ways of looking at it. And it opens my eyes to a lot of things that I would have normally stayed closed off to because I grew up in a very judgmental household. So it was hard to break that mold. But once I did, it was like, no, I'm not going back to that. There's so
Oh,
much
yeah.
from everybody, so I'm gobbling up information as I go along. And
Yeah.
uh,
I think one of the things that make me successful is that I'm open-minded to ideas and thoughts and
yes,
other people's concepts. And I don't want to poo-poo it unless I have a good reason.
yeah, I agree. So, what are some common misconceptions about holistic healthcare that you like to clear up for people that you know of?
I think that people think it's one or the other. Like if they do things holistically, that they can't do things traditionally.
Yeah,
And so it's not one or the other. It's that integration of the best of both worlds. So I also have a daughter with type 1 diabetes, and she has to take insulin. There is no natural treatment that is going to help her. She has to take it, otherwise she will die. And so some of my patients feel, they go to the extreme where they don't want to take a medication because they say, "Oh, I don't want to do any medication." But sometimes you need to. Sometimes it's necessary for whatever medical reason. So I think that it's not just one or the other, and that's why I think it needs to be integrated in all the practices. When we see our regular doctor, they should integrate these kinds of modalities and approaches so we can get a whole approach. That's the holistic approach. And then one of these days they'd have to integrate, uh, you know, energy and spirituality and all of that too.
yes,
Because that's the best way to heal.
it is. It is. And, but a lot of people still think of that as woo woo, you know.
All energy. So just because you can't see it doesn't mean it's not there.
This is true. Let me see here. What let's see here. I have a question for you, but I wanted to see how I wanted to word this one. Um, do you have any advice for patients or people on how to navigate cost or find affordable options for the holistic healthcare practices?
Yeah, there are some practices where they do take insurance, like integrative pediatric practices that are starting to do that. There are other options in terms of who you start with. There are, like I said, if you go to like medmaps.org, they have a list of practitioners, and some practitioners, they vary from life coaches,
Oh,
chiropractors, nutritionists, and then, further into it, obviously there's OT, PT, speech therapists. And so there's just a wide variety. And I think if you're starting new, you don't have to see, somebody like me who I've been doing this for 30 years. I teach it. And so again, I'm a little expensive, but even with me, we try to keep the cost down. I tend to see my patients maybe twice a year, 3 times a year, and talk to them in between appointments, and then order labs through their insurance. And we're working with some insurance companies now to get some of the other what we call specialty labs to get covered by insurance. So we are working really hard now with some of the new people in government. We have somebody who's actually listening to us, and so that is helpful.
it's very
And
important.
yeah, and so that hopefully we can make that shift because it is expensive when you're trying to um, buy supplements or do a therapy, and but it's not it's really like it can be worked out because it's not like you have to do everything tomorrow. You do things in stages. And then if there's a big therapy that you want to do, you can save for that therapy. And there are organizations and nonprofits that give out grants as well.
Okay.
Yeah, there's TACA, the Autism Community in Action, takanow.org. They give out grants. And there's other organizations that give out grants. There's a International Hyperbarics Association for people who are interested in that. I know they give out grants as well.
Oh, awesome. So maybe you can mention some of the ones. You've mentioned some of them, but any of the other ones you want to throw in there, I will make sure that that gets posted.
Yeah,
So,
those are the ones that are coming to mind, but I know a lot, I have quite a few patients that have grants and they come to the office with the grants from the local community um for their for my for their medical care, and then they're able to use it in any way they want.
okay. Well, that's
And
really
then some like with some jobs and some people have, those healthcare plans where they can use some of the money towards other modalities.
okay. These are great things to consider because I had actually heard of some of the holistic practices or even actual physicians that went private that offer what is it called, like a membership model.
Yeah,
So
they call it concierge.
what was that again?
Concierge, like concierge medicine.
Oh, okay.
So they pay a membership and then they are able to access the doctor or appointments with the membership.
Yeah, I had heard about this a few years back from some of the doctors. My husband's a nurse, so some of the doctors that he had worked with for years decided to leave that network because of whatever reasons, and they did better. They felt better anyways, and they had more control over what they were doing it that way. So that was interesting. But that
Yeah, it's really, they have their hands like kind of tied in a way in certain practices because they have to follow specific guidelines. And even just to order a test, I had a patient who had a thyroid issue and their doctor wouldn't prescribe the medicine. They had to send them to an endocrinologist. And I thought that was odd because I'm a family practice doctor and I was trained to really take care of whatever needed to be taken care of. And if I couldn't handle it, then I would refer. But I don't know what's happening now. It just everybody sees a different doctor for every every different thing that they have.
it's true. It's like it's dissected up to where, oops, I can't order that lab if that has to be looked into. I've got to send you to a, like you said, the endocrinologist or the gastrologist or, you know,
Cardiologist, yeah,
yeah,
yeah.
I'm just out. You know?
No. I know, just out.
That's
It,
crazy.
that's, I think people are dissatisfied, doctors are dissatisfied with healthcare because it's so segmented,
Mhm.
and then their hands get tied. So it's not a good way of managing people because it's hard to know, you only know your thing, and if it doesn't fit into your little category, I hear this from patients all the time. They'll go to a doctor and they'll say, "Well, it's not this." And then they never tell you what it is. But it's not your heart. It's
Well,
not
this,
your liver. It's not your gut. But what is it, doctor? Well, I don't know.
yes. And then I think it's so much so with our traditional medicine that it's mainly governed not just by what the doctors feel that they should do for their patients, it's what the insurance company and the network that they're working under says that they need to do for their patients, and that's how I feel.
Mhm.
I have no facts to back it up. It's just my
I
observation.
have facts. I have facts. I have this patient. She's been on a medicine for 15 years. It really helped her a lot. It's an enzyme that helps digest sucrose. She has a sucrase deficiency. It was biopsied. They found it 15 years ago, and all of a sudden, insurance said they won't pay for it, that she needs to be biopsied again. And she's a young lady. She has cancer. She has autism. She's non-speaking. I'm not going to put her through that. It
Well,
was, we already have the diagnosis. Plus, she's doing really, really well on the medicine. And the minute she stops the medicine, she gets worse, but they won't pay for it
yeah, it's a
anymore.
there has to be some way that that people can rally to overthrow the insurance companies. Their strength of what they have behind ruling what a patient needs or what they don't need, because they're obviously not the doctor. So
No, then they say they have a system where you try to talk it through and end up talking to a doctor about it. And the process takes a long time. In the meantime, she's crying, she's in pain, she's not well, and that takes weeks or months to go through. So
let's see. Is there anything that you would like to leave the listeners knowing about your practice, your way of holistic care, basically like a last word or a last insight into how it is you do what you do? Okay. So a little technical
yeah.
is always fun.
Oh no. Yeah, for patients just to people with chronic illnesses to think about how they can incorporate integrative and holistic medicine into their their healthcare plan and not just rely on medications that band-aid symptoms and really get to kind of to the deep root of some of the issues that they might be facing and change some of their lifestyle approach with their diet, with exercise, with their mindset. All of those can be really helpful.
I think that's great. And I really believe that's where we all need to start first. So yeah, I agree with that. I love that. Um, Thanks for sharing what it is that you do. And I know that all the parents appreciate your work and your heart that's fully in it. And that's the main thing. So I know they're totally grateful. And I'm grateful to have you in your brilliant mind to pick, because there's so
Anytime.
much to ask and and so much to learn. And when you share the knowledge, it's priceless, really, because that little bit of information sprinkled along the way can change somebody's life that, maybe they've heard it before, but it didn't really register or didn't hit them the same as it hits them now, kind of thing. Because I've had that happen, in my lifetime to where, oh, yeah, I've heard that before, but this is definitely hitting different now. So I think that, the more information you get out there and share with people, the hit them now is what it's going to hit. That information is going to be like, oh, wait a minute. Now's the time to do something to start that change. That's important. So I appreciate that. And thank you for sharing your journey with me as far as your position, your practice, however you want to put it.
Oh, you're welcome. Thank you for having me.
Welcome. And I'm going to stop this one. Let's see. Okay, I think we're recording now. Does your end show recording? We froze. Okay. I think it's recording now. My computer, I don't know what this is. It's not a bad day. I have good signal, but it just doesn't want us to fully communicate. So
Yeah, always happen. I was on a I was on some podcast in the Philippines and it just kept going off.
that's crazy. I could not be no more closer to my router if I was sitting on top of it. It's like right here. So
And I do this a lot. I do podcasts and things like that with people all the time. Hardly ever happens.
well, let's see. Okay, so I know digitally I can slice this into where we can start again on this little section of what we're doing now. Today I'm doing interviews for previous clients or clients about their previous readings. And I would like for you to share some of your experience with the reading process, whether it be psychic or mediumship, however you want to go into it. But can you share like a specific moment from your reading that really resonated with you or gave you clarity?
Yeah, I was thinking about that because I've had quite a few readings with you, Deshauna. I've had a healing reading and I've had a photograph reading. And when my dad passed away last March, I was not in a good state, and you got on the phone with me or a Zoom call with me, and you did a reading for me. And it that particular reading gave me a lot of comfort.
Oh,
You A thing that my dad and I would do all the time was my dad was always cold. And I would always make him hot tea. And when I would be sitting at the desk, even if I had Zoom calls or clients, my dad would come and bring me tea. And it was just a thing that we would just sit under the covers and drink tea together. And after he passed, you told me that my dad was holding my hand and trying to give me warmth.
yes.
And that concept of my dad bringing me warmth um, really resonated with me.
Oh,
And I still think of that
oh,
when I miss him all the time. And, you know, I, uh, I needed to hear that, and it was helpful for me. So thank you.
you're very welcome. And that's a blessing to know that, you know, that impact and that connection, that I can be that mediator in between effectively. Because sometimes, when we talk about black and gray areas, or black and white areas and the gray areas, sometimes the interpretation part can be gray. because
Mm.
it comes from what I
Mm.
know, to what they know, to what they're trying to get convey. And, sometimes you can get it 100% accurate, and other times it's kind of like, okay, this is pretty much what they're saying, but I'm putting it on my spin, because it's just
Exactly.
it happens. But
Also, your cultural background, because my cultural background is Indian. So, like, if they give you clues and from our culture, you may not necessarily see them or pick up on them because
yes,
you may not know what that is.
yeah, you're right.
So,
I've learned so
yeah.
much. I've actually, it has opened me spiritually just by listening to the other side. And I know that might sound a little weird, but they've taught me,
No, it
they've really taught me a lot. So thank you for sharing your family with me. Um, okay, so here's another question for you. How did you feel before the reading and after the reading? I know you pretty much said that that was the reading about your hasn't, and you had been missing him. You were in a bad spot, and then that gave you a lot of comfort for after that reading. Was
hmm
you've had several readings with me, so um, has there been a reading that caused a shift within you or a shift in what's going on? Like a different insight. Maybe it could have been a psychic reading or a mediumship reading.
I, f- I feel like when I get readings or when I need a reading, it's because I feel lack of clarity and I may feel I don't know, a direction. And after I've talked to you or you've given me some insight, there'll be like a trigger word or some words that you'll say where it just kind of makes that clarity come and feel a little bit more tangible. I had a reading with you and my mom my mom passed over and my mom's kind of funny and she's really, really sweet. But you said something like, your mom doesn't want you to take that shit from anyone. And then I was like, that sounds like my mom. And so I feel like I was, before the reading, I feel like I was taking shit from somebody, and I was allowing it to happen. And then after that, I was like, okay, I know I'm not going to do that. I'm not going to do that. And that's not coming from you, it's coming from my mom.
Right. I think that's interesting because some personalities can come through so strongly. Like everybody knows that movie Ghost with Whoopi Goldberg, and
Mm.
so and it almost feels like that nobody ever takes possession of me. I just want to clarify that, but their energy and their personality can come along so strong. Like if they're adamant about something, my voice will be more stern, especially if they're very stern on something, like they're matter of fact, then I'm going to
Mhm.
have a matter of fact tone. And without even knowing it, it just like, wait a minute, we're in serious business here. So
Sure.
I find that interesting. And that's what I love about it, because their energies, this is what makes me know that life continues on, because the energy feels the same to me, whether they're sitting in front of me or if they're on the other side. So it's really wild. And it's I just can't explain it any other way. Let's see here. Um, was there a particular um, psychic insight that you have been given that has helped you more, other than just keywords? Was there anything else that really stood out to you? I think what I'm, and I keep wanting to bring this up because it has made an impact on me so bad, like not in a bad way, but it was funny because when I first started opening up and doing the readings, like really in depth, and doing the picture readings, your very first picture read with me was kind of like an anomaly. I've never had that happen ever before. And I know it stayed with you because it stayed with me. You gave me a picture.
Did.
I go into full detail with it, but I gave information of a specific person, and you knew I was totally describing a specific person, but it wasn't the person of the picture that you were asking to
Right.
be read of. And
But
that,
you nailed the other person.
yes, and to me that was pretty wild. And then now, years later, the insight is given, like that's really where the attention was trying to be diverted to. That person in the picture that was, you come to me for the reading for, was saying, hey, wait a minute, I want to focus on this person here. So and the only way to do that is if you start saying everything about this person, because I had no idea any of those things about him. And to me, it just floored me because I was like, you're like, no, that's not him. And I'm like, well, he's telling me, I'm very adamant. He's telling me.
No, that definitely stood out because the person you were talking about, you kind of described him to a T, so I know it was him. And even what you said about him, that even sticks with me to this day. Um, you said that he said that we're better together than we are apart, and we are. We are that
Yeah.
way.
Yeah, that's pretty wild. So
Mhm.
I know that even with some of the readings that I've done for my clients, some of their readings stick with me and it impacts me. And it's like, wow, I can't even believe it. And I get just as mesmerized, with not even being on the receiving end, but on the mediumship end, I'm like, wow, I'm blown away because it's the phrase that you can't make this shit up. I mean, I literally, you just can't.
I'm just in awe sometimes. I'm just in awe.
And
That's the word I have for it. It's just there's no words to describe how amazing it is.
is and the stronger the connection is between the sitter and the reader, the stronger things come through. And you open my eyes to watching that podcast about the telepathy tapes, because I had never heard of them until you said you need to watch those. That's pretty interesting. So when I watched them, it just felt like comfort, and I was like, oh, I don't feel so strange, because it's hard to describe what you can see, hear, and feel, and even see from somebody else's eyes. Like you're looking through their eyes, like, that saying, the fly on the wall. Well,
Yeah.
literally, I'm not the fly on the wall when I do, things, when I go that deep, because I can feel like as if I'm sitting there with you right now. And, it's wild. It's so hard to put into words. That's why it's hard for people to talk about it, because you don't know if people would actually understand what it is that you're trying to describe.
Yeah.
So,
I think the more you talk about it and the more people open up to it, we all have these gifts.
yes.
Yours are more profound, and my patients with my non-speaking patients are profound and they have gifts like that we don't necessarily have. The rest of us who don't have those gifts. However, when you become open to them, then you start seeing them and you start feeling them, and it's like, oh, okay, I get it. At least I get it. I may not be able to do what you do, but I can be open to the idea of it.
Yeah, it's definitely interesting.
Maybe yeah, maybe you didn't grow up with that, and that's what makes it hard for you, or why you may think that you're strange or different or unique, or but I think there's a lot of people who have these gifts and they're just afraid to talk about them.
Yeah, I believe so too. I think I'm finding my tribe, though. I think I am. And I'm happy with that, because it is kind of like recluse kind of until you find other people you can actually have those conversations with without saying, oh, you need a psychiatrist or, you
Right.
know, you're a
Right.
little cray. And I'm
Yeah.
thinking, well, I'm going to take my crazy out and play with it for a little bit and see.
That's how I feel about medicine sometimes, because people might think that what I think is a little crazy.
No, I think, well, the beauty part of that is you have the education along with it. So I think you have an intuitive sense that's very strong with each one, each connection, which client connection to me, because I see you connecting with them, the heart center's connecting. So the connection that you have with them gives you a different intuitive sight like every time that you're with them or especially in their physical presence. And then sometimes I feel that you will even get like an aha moment, like, oh, wait a minute, they've got to, and they're not even in front of you,
Oh,
but
yeah.
you don't even
I
see
had
me.
that today answering messages. A parent was sending a message about the kids screaming and crying and pulling her hair. And I said, this sounds like SIBO. And I really think that's what it is, small intestinal bacterial overgrowth.
Okay.
And I sent a message to the mom. She was like, that's what it sounds like. She said, I read all about it. I think that's what this is. And I said, yeah, it really sounds like that.
See, that's
And
your
I
gift.
didn't even get much of a history to figure it out. I have like three sentences. But
But our gifts don't are not going to always look the same, and we're not going to use them the same. Mine
yeah.
not might not just be given readings. I feel there's more to it than that. Just like how your gift is that extra insight into what can help your patients. That's a blessing. Every little insight that you have like that, the more connected you stay to your patients, the faster those insights are coming. And I love it. Thank you for sharing your time with me, your life with me, because a lot of things that we discuss privately are, not for outside of the walls. This is something sacred that you want somebody that you trust that you can kind of confide in to give you that insight. So I just want to say thank you for that.
Oh, you're welcome. You're
And thank
welcome.
you for
I
these.
lost you there for a minute.
Oh, well, I saw you the whole time.
I just like, where did you go?
Surprise.
You're back.
But thank you for this. I appreciate
You're
it. And
welcome.
reach out if you need me or if you have any questions or comments or any other website
Good.
that can be posted along with this
Okay.
and help anybody. I'll be happy to post those too.
Okay. Yeah, some people. All
Thank you.
right. Sounds good. Thank you.
Bye.
Bye.